The name of this company is Philadelphia American Life Insurance Company, or POLIC for short. The company was founded in 1924, with the current management taking over in 1989. POLIC is headquartered in Houston, Texas, with a BBB triple plus rating by AM Best. Current major medical plans have been a staple for most Americans. However, their costs have increased greatly since the emergence of the ACA. The major reason for cost increase is the 10 essential benefits that must be embedded in all major medical plans. 8 of these benefits are included in some way in the POLIC plan. They are hospitalization, prescription drugs, emergency services, laboratory services, ambulatory patient services, rehab and facilitative services and devices, preventative wellness and chronic disease management, and mental health, substance abuse, and behavioral health. The POLIC plan does not have maternity and newborn care or pediatric dental and vision care. While these benefits are great for young consumers, it is not a necessity for all persons and contributes greatly to the cost of a policy. Therefore, we would advise that if maternity is something that may be needed in the near future, you may be better suited purchasing an ACA plan. The POLIC plan can include dental insurance with a vision discount program in a separate policy and may already be included in your quote. Also, all ACA plans must have no pre-existing conditions limitations, unlimited coverage, and no copays for routine physicals. Each one of these benefits is great for the consumer, however, it does increase the cost of a policy. As an example, with a no pre-existing conditions limitations clause embedded in every ACA policy, a person can sign up for an ACA plan in the hospital in the middle of December. In this example, the major medical policy must start paying the hospital bill on January 1st before receiving their first payment from the policyholder. You can imagine the additional cost this could add to ACA policy costs. The HSP III policy keeps costs under control. The Health Saver Plus 3 is a high-end limited benefit fixed indemnity plan and not a major medical insurance plan. Fixed indemnity benefits are provided for hospital confinement, specified medical, surgical, and outpatient events. These benefits are paid in specific amounts and do not provide expense reimbursement for charges based on your health care provider's bill. With a major medical plan such as BCBS or Humana, their plan pays based on the expense incurred. The deductible is applied against eligible expenses before the insurance starts to pay. With this high-end hospital indemnity plan, the plan pays based on the defined benefit schedule, very similar to Medicare. The deductible is applied against the eligible benefits. Here's an example of how are deductibles applied under hospital indemnity plans. The deductible is applied against eligible benefits and not eligible expenses. It's simple. Add up the reimbursement for all eligible benefits and subtract the selected deductible. This is how it works. In this example, we use eligible benefits based on 3 units. The definition of a unit is a category of benefits with a specific dollar value. This is a total of 3 categories of benefits associated with specific dollar values. Category 3, also known as 3 units, is the richest with the highest dollar value. Once you have signed onto a category, you will keep the dollar value associated with that unit of benefits. Here is a 3-day hospital stay for an injury which pays $6,000 a day. $6,000 times 3 days equals an $18,000 benefit. The surgeon is paid $4,954.65. The anesthesiologist receives 25% of the surgeon's fee, or $1,238.66. Therefore, the total eligible benefit in this example adds up to $24,193.31. Unlike a major medical plan, we subtract a $2,500 deductible last. Therefore, when added up with the deductible subtracted, the total benefit paid is $21,693.31. This is what Pollock pays out, not what the hospital charges. Pollock will always pay the total benefit amount. Therefore, if the hospital charges $18,000, Pollock will pay the hospital's charge of $18,000, and the policyholder will receive a check for the difference, $3,693.31. On the other hand, if the hospital charges $24,000, which is $2,306.69 more than Pollock will pay, the policyholder would owe the hospital this difference. The purpose of this presentation is to educate policyholders on how to keep medical costs below what the hospital charges by using the multi-plan PHCS PPO network. Now let's see what's in the policy. The key features of the HSP III policy includes the following: a $5 million lifetime maximum limit per policy. You may choose from 3 benefit options. You will pick your base plan deductible. You will pick your calendar year benefit maximum level. You will get to choose the number of benefit units to fit your needs. In addition, you can use any doctor or hospital you choose or select from the large PHCS PPO network of doctors and hospitals to take advantage of greater savings. Most doctors participate in this PPO network. You have the option of 5 calendar year deductibles. You may pick one of the following deductibles: $100, $500, $1,000, $2,500, or a $5,000 deductible. This plan lets you choose calendar year maximum benefits per calendar year. The most commonly chosen benefit is the $250,000 calendar year option. However, if you require more calendar year benefits, you may choose the $1 million benefit option. So think of the annual maximum benefit as being a bucket of money you purchased. Each time you have an eligible medical expense, money comes out of the bucket to help pay those expenses based on the benefit plan selected. Every year, Philadelphia American refills the bucket. This only means that at the beginning of the year, January 1st, Pollock maintains a minimum balance of your chosen calendar year benefit. In this example, it would be $250,000. When you receive services at the hospital, you may have an itemized bill. This bill will include a facility fee, which is the hospital's cost, and a service fee, which includes the cost for professional medical personnel such as the surgeon, assistant surgeon, and anesthesiologist. This page addresses only the facility fee of the HSP III policy. Remember, the definition of a unit is a column of benefits. Once you have selected the number of units that fits your needs, you will remain in that column. We will focus on 2 units for this example. For a hospital confinement, meaning you are admitted and stay overnight in a hospital for 2 units, the plan will pay $3,000 per day for a sickness and $6,000 per day for an injury. For a hospital intensive care unit confinement for 2 units, the plan will pay the daily benefit selected of $4,500 per day for sickness and $6,000 per day for an injury for a 20-day period. On the 21st day, this converts back to the hospital confinement benefit of $3,000 per day for sickness, but stays the same at $6,000 per day for an accident. For mental illness, alcohol and/or substance abuse, the indemnity benefits are stacked. With 2 units, the plan will pay $400 per day plus the hospital confinement benefit of $3,000 per day, bringing a total daily benefit to $3,400 per day. When using the rehabilitation and skilled nursing facility indemnity benefit for 2 units, the indemnity benefits are stacked. With 2 units, the plan will pay a daily benefit amount of $1,500 per day, plus the hospital confinement benefit of $3,000 per day. This brings the total benefit to $4,500 per day. When a covered person receives treatment for outpatient radiation or chemotherapy when confronted with cancer for 2 units, the plan will pay $1,500 per day. Finally, for an outpatient hospital or ambulatory surgical center, the plan will pay the daily indemnity benefit selected for outpatient hospital or ambulatory surgical center services when surgery is performed as a result of a covered injury or sickness. The calendar year policy deductible will be waived for the first claim incurred in a calendar year for each covered person when surgery is performed under general anesthesia. For 2 units, this benefit pays $3,000. As mentioned before, professional services such as surgeon, assistant surgeon, and anesthesiologist fees are itemized and billed separately. This page addresses the professional medical services performed in a hospital. For surgical benefits, the plan will pay the daily surgical indemnity benefit if a covered person undergoes a surgical procedure when performed in a hospital or an ambulatory surgical center due to an eligible injury or sickness. When the surgical procedure is performed in an outpatient hospital or ambulatory surgical center, the deductible will be waived for the first claim incurred in a calendar year for each covered person when surgery is performed under general anesthesia. The reimbursement schedule for 1 unit for surgical benefits is similar to what is payable under the Medicare Physician's Fee Schedule for surgeries. This is also known as the Resource-Based Relative Value Scale, which is used to determine how much money medical providers should be paid. For inpatient pathologists and radiologists, the plan will pay the daily indemnity benefit if any covered person undergoes an inpatient pathologist and/or radiologist procedure as a result of a covered injury or sickness. The reimbursement schedule for 1 unit is similar to what is payable under the Medicare Physician's Fee Schedule for surgeries. This benefit, Physician's Care Indemnity Benefit Non-Surgical, is paid for each visit a covered person receives from a physician while confined. For 2 units, this benefit pays $100. The Daily Assistant Surgeon Surgical Services Indemnity Benefit for covered services pays 20% of the eligible surgical benefit. The Daily Anesthesia Indemnity Benefit for covered person pays 25% of the eligible surgical benefits. This page is dedicated to outpatient benefits such as doctor's office visits, lab work, x-rays, prescription drugs, and urgent care. The HSP III has 2 deductibles, one for inpatient care and the other for outpatient non-surgical care. For outpatient non-surgical care, there is a $50 deductible applied to testing, lab work, urgent care, etc. However, for doctor's office visits only, the deductible is waived for the first 3 visits and applied only to the 4th visit in a calendar year. This deductible is not waived for other outpatient benefits such as CAT scans, prescription drugs, and emergency or urgent care. Keep in mind, the indemnity benefits shown on this page are what the insurance company pays. These are not copays. As an example, let's say the average price to see a doctor in your area is $120 per visit. When you stay in the multi-plan PHCS PPO network, you will receive their pre-negotiated price. This means you receive a substantial discount. In some instances, the reduction is between 40 and 50%. When you present your card to the doctor's office, if given a discount of 50%, this will reduce your cost to the value of the indemnity benefit, $60. As a result, if you have chosen the 2-unit benefit category, you will owe nothing at the doctor's office. If, on the other hand, the pre-negotiated price is $80 and the indemnity benefit is $60, then the policy owner will pay the $20 difference. On the other hand, if the pre-negotiated price is $50 then the doctor will receive $50 and the policy owner will receive $10. Remember, this plan always pays the benefit amount to someone, even if there is another insurance policy acting as the primary for the insured. For other outpatient benefits, the deductible is applied immediately to the first visit. The HSP III plan will pay the following when purchasing the 2-unit indemnity benefit. For MRI, CAT scans, or nuclear testing, the plan pays $350. For other diagnostic testing or X-rays, the plan pays $80. These two benefits are enhanced tremendously for accident benefits when paired with the Enhanced Accident Expense Plan, which is included in this quote. We will review this later in the presentation. For laboratory testing, the plan pays $20. And for injections, the plan pays $10. The daily generic prescription indemnity benefit is $10 for 2 units. The brand name prescription indemnity benefit is $20 for 2 units. The prescription drug benefit is the only benefit that is reimbursed. It would be more convenient to file claim forms every 6 to 12 months as opposed to each time a prescription is bought. The emergency room benefit has a limit of 1 use per calendar year and pays $200 for 2 units. The urgent care center benefit has a limit of 1 use per calendar year and pays $100 for 2 units. The preventative care indemnity benefit starts 60 days after the effective date and is limited to 1 benefit per covered person per calendar year. This benefit is not subject to the calendar year deductible or pre-existing conditions exclusions. This benefit includes things like mammograms, pap smears, colonoscopies, etc. This benefit pays $125 per calendar year. The emergency ambulance indemnity benefit is limited to 2 benefit payments. 1 benefit payment for ground transportation, which is $500, and 1 benefit payment for air transportation, which is $1,500. These benefits are increased substantially for accidents, which will be presented later in this presentation via the Enhanced Accident Expense Plan, already priced into your premium. When you qualify for an HSP III policy, the plan covers pre-existing conditions after 12 months of continuous coverage on the plan. So let's define a pre-existing condition. A condition for which treatment was rendered or recommended by a physician or for which drugs or medicine was prescribed within 12 months prior to a covered person's effective date and will not be covered for the following 12-month period. Maternity is considered a pre-existing condition no matter when the pregnancy occurred. It is important to note that pre-existing conditions applies to all benefits with the exception of the preventative care benefit. Repricing is still available through the multi-plan PHCS PPO network. The rest of this presentation on the HSP III policy will be devoted to the multi-plan PHCS PPO network. While you can use any doctor or hospital you choose without penalty, you have the option of accessing the PHCS network to take advantage of great savings at no additional cost. The advice here is always use the multi-plan PHCS PPO network when possible to get costs below what the policy pays. Here's how network benefits will work when using the HSP III indemnity plan. 1. The policyholder will present the POLIC card at the time of service. Again, POLIC stands for Philadelphia American Life Insurance Company. 2. The doctor or hospital will verify coverage based on information on the card. 3. Charges will be forwarded to the National Claims Clearinghouse. 4. The National Claims Clearinghouse will electronically forward information through Electronic Commerce Operations Management Line, ECOM for short, who will reprice the claim. 5. Ecom will reprice the claim and send it electronically into Pollock's claim system. 6. The PPO discount will be shown on the explanation of benefits, or EOB, that is sent along with the claim payment to the provider of service. Benefit payments, in most cases, are sent directly to the participating provider. 7. If the HSP III policy pays more than the bill charges, but less than the PPO discount or allowable charge, Pollock will send the provider the PPO allowable amount and reimburse the policyholder the difference. Now, let's look at a couple of repriced claims. Here is an explanation of benefits from a provider in Tyler, Texas for a metacarpal fracture. This is a broken bone in the hand. As you can see, we have the line items, the date of service, and next, the CPT codes. CPT stands for Current Procedural Terminology Codes that signal to the doctor or hospital the amount a procedure should cost. Each procedure has a CPT code with an associated charge. The column titled Charge is what the hospital would have charged had the procedure not been repriced in the multi-plan PHCS PPO network. PHCS stands for Private Healthcare Systems. Quick note here, Multiplan bought the PHCS network in October of 2006 to become one of the nation's largest private healthcare networks. Next, we have the number of days in the hospital and then the allowable charge. The allowable charge is what the multi-plan PHCS PPO network will allow that provider to charge as a member of PHCS. As you can see, the allowable charges are considerably less than the associated CPT code's sticker price. In fact, the allowable charge has a $5,749 savings or 56.87% discount off the sticker price. Next, we have two examples of an actual 3-day hospital stay for prostate cancer with a $1,000 deductible using the HealthSaver Plus 3 policy. The first example on the left uses 3 units, which has a daily hospital benefit of $4,500 per day. As you can see in the second column, we have CPT codes next to the associated expense. The expense column is what the hospital charges and not what the plan will pay. The total expense for a 3-day hospital stay before using the PHCS network is $24,848.89. The eligible benefit, which is what the plan pays, is $22,303.04. The plan will always pay the assigned benefit amount regardless of the network or other insurances used. Now we subtract our $1,000 deductible last, and we have a payment amount of $3,545.85 that the policyholder owes to the hospital. Now, let's stay in the PHCS network to take advantage of the savings. As you can see, the hospital bill has been repriced by 40%, leaving a total expense of $14,909.33. Now let's apply the eligible benefit and subtract our deductible last. What do you have? Now you receive an eligible benefit going to you of $6,393.71. In other words, you walk out of the hospital with cash. Next, using the same hospital PPO discount expense of $14,909.33 and applying 2 units as an eligible benefit, we have a total eligible benefit of $14,868.70. Now we subtract our $1,000 deductible last, and we are left with an out-of-pocket expense of $1,040.63. Compare these out-of-pocket expenses to a major medical plan. Remember, with a major medical plan, you will pay your deductible first. In many cases, your deductible may be $6,000 or more. This would be your out-of-pocket expense before coinsurance kicks in. Next, we see the multi-plan PHCS PPO network search engine as it would appear online. Here you can search to see if your doctor's in the network in advance before having a procedure. We will go into more detail in a separate video. Next, we have the number of facilities and physicians along with discounts of the PHCS networks in several cities in the U.S. This spreadsheet has a summary date of April 2016. The rates, providers, and facility charges may have varied slightly from April of 2016, but overall they have stayed the same. For Dallas, the number of acute facilities in Dallas, Texas is 74. The number of ancillary facilities in Dallas is 1,341. The number of primary care physicians in Dallas is 3,599. The number of specialists and practitioners in Dallas is 9,582, and the number of total practitioners is 12,100. The effective discount acute inpatient percentage rate in Dallas is 36%. The effective discount acute outpatient care percentage rate is 33%. The effective discount ancillary facility percentage rate is 49%, and the effective discount practitioner percentage rate is about 47%. What I have hinted to in your favor, already priced into your quote, is Pollock coordinates 3 policies combined as one presentation, one quote, and with one overall premium. Because the HSP III is an indemnity plan, these other 2 policies are used to support the HSP III where needed, such as outpatient benefits and cancer care. The second policy is an accident expense plan. Remember, the HSP III policy always pays in addition to any other policy, such as the enhanced accident expense plan. So now you could have 2 policies contributing to the same accident claim, making sure all bases are covered. Here is a benefit summary of the enhanced accident expense plan. We will focus on 2 units, for this is what is shown on most quotes. An accidental injury benefit could include any accident such as a fall, burn, cut, broken leg, etc. As mentioned before, this plan enriches the outpatient benefit of the HSP III. The plan will pay $4,000 per incident. Unlike the HSP III, this plan will pay the exact amount of the claim. The difference will not be forwarded to the policyholder. If there is an accidental death of the primary policyholder, the plan will pay $100,000 to their beneficiary. For ground and air ambulance transportation in the case of an accident, the plan will pay $10,000. Again, this is in addition to the HSP III ground and air transportation, enriching the HSP III policy benefits for stronger accident coverage. If a person is confined in a hospital, the plan will pay $300 per day for 30 days. Major medical plans don't do this. The dismemberment benefits for the enhanced accident expense plan are: for the loss of a single finger or toe, the single benefit is $1,000, while the multiple loss benefit is $2,000. For the loss of a hand, arm, foot, or leg, the single benefit is $10,000, while the multiple loss benefit is $20,000. For the loss of sight in an accident, the single benefit will pay $10,000, while the multiple loss benefit is $20,000. Now we move to the third policy, critical illness insurance, already included in your quotation. This policy complements the HSP III in case of critical illness such as cancer, heart attack, stroke, and 8 other critical illnesses. This policy pays up to $50,000 in cash benefits if diagnosed with a critical illness. The cash benefit can be used for unexpected expenses associated with a critical illness such as travel, food, transportation, babysitting, car payments, or just about any expense you can think of, including a vacation. This policy has dual categories. Therefore, If you receive a lifetime cash benefit of $50,000 in the cancer category, you may also receive an additional lifetime benefit of $50,000 in the heart attack and stroke category. This makes this benefit worth a total of $100,000. Teladoc is a convenient alternative to urgent care or ER visits. U.S. board-certified physicians are available anytime, anywhere, and can resolve many non-emergency medical issues. They can resolve most non-emergency medical issues via phone or online video, thereby saving you time and money by getting no-cost care quickly and almost effortlessly. Have drug prescriptions electronically sent to your local pharmacy. This benefit really comes in handy with children who almost always need medical attention for childhood ailments. To learn how to look up doctors in the PHCS network, check hardships and exemptions to get out of the Obamacare penalty fee, get discounts on prescription drugs, or check Healthcare Blue Book to review charges that are customary, usual, and reasonable, see the next video. This concludes the video presentation. If you still have questions, contact your agent for answers.